So today, we're diving into something that sounds like it's straight out of science fiction, but it's a profound reality for millions of people. We're talking about a literal ghost in the machine.
I mean, just think about that for a second. How is it possible to feel an itch, a pain, or even just the presence of a hand that you know for a fact isn't there? This one question completely flips what we think we know about our senses and where our sense of reality actually comes from.
This experience has a name, phantom pain. And let me be absolutely clear about this. This is not psychological. It's not just in someone's head. It is a real, physical sensation, a biological phenomenon that has its roots deep inside our nervous system.
And it is shockingly common. Get this, somewhere between 60 and 80% of people who have had a limb amputated experience this. So what that tells us is that this isn't some rare fluke. It's a standard, though incredibly difficult part of the journey for the vast majority.
Okay, so how do we even begin to understand this phantom? Well, first we've got to make sure that we're all talking about the same thing, because it's easy to get it confused with a more familiar kind of pain.
And this is a super important distinction. On one side, you've got what's called stump pain, or residual limb pain. That's pain located in the part of the limb that's still there, and it's caused by normal stuff, like infections or tissue damage. But phantom pain? That's a whole different beast. The feeling is located in the limb that's gone, and the cause isn't in the tissue at all. It's coming from the brain and the spinal cord.
All right, so how on earth does this happen? To figure this out, we have to become detectives. We've got to follow the trail of clues, these faulty pain signals, as they travel from the original injury all the way up the line.
So you'd think the story starts and ends right at the injury, right? At the stump. And it does start there. But that's just the first domino to fall in a much longer, much weirder chain reaction. The real mystery unfolds further up.
So here's how that journey plays out, in two main steps. First, at the stump, those severed nerves can get all tangled up, forming these messy knots called neuromas. Think of them like faulty wiring that's just spitting out random chaotic pain signals for no reason. Then, those chaotic signals hit the spinal cord. And the spinal cord? It basically acts like a giant stereo amplifier with the volume knob cranked all the way to 11, just blasting that noise right up towards the brain.
Which brings us to a huge question. Okay, so if the nerves are just spitting out static, and the spine is just making it louder, they're just the messengers, right? So who or what is on the receiving end of this garbled message? And why is it interpreting all that noise as intense pain in a limb that doesn't even exist?
Well, the answer, the real culprit, isn't in the limb or the spine. It's in the most complex organ we have, the brain itself. And more specifically, in its internal and kind of spooky ghost map of our own body.
This whole thing hinges on a concept you've probably heard of called neuroplasticity. It's the brain's amazing ability to rewire itself based on experience. It's how we learn. But, and this is a huge but, sometimes that rewiring process goes haywire. It becomes maladaptive. It creates faulty new connections that end up generating very real, chronic pain.
So let's take a look at this map inside the brain. In an area called the somasensory cortex, every part of your body has its own dedicated piece of neurological real estate. And check this out, because this little detail is everything. See how the area for the hand is right smack next to the area for the face? Tuck that detail away because it's about to become really important.
Okay, so here it is. This is the big aha moment. After an amputation, that whole hand section of the map, it goes dark. Radio silence, no more input. And the brain just hates empty space. So what happens? The neighbors move in. That face territory starts to creep over, invading and taking over the now silent real estate that used to belong to the hand. And the result of this neurological land grab is just bizarre. Because those face neurons are now squatting in the hand's old territory. A simple touch on the cheek can send a signal that the brain reads is coming from, you guessed it, the missing hand.
So, if a scrambled brain map is the problem, then the solution has to be unscrambling it, right? And this has led to some unbelievably clever ways to basically hack the brain, using its own rules against it to bring some relief.
And the core idea behind all these hacks is actually beautifully simple. To fix the bug in the system, you have to give the brain the one piece of data it's desperate for. It needs to see the missing limb moving again, normally and without any pain. That visual input can be powerful enough to convince the brain to start fixing its own wiring.
The classic example, and maybe the most elegant one, is mirror therapy.
The setup is pure genius. A person places a mirror so it hides their residual limb. Then, they position their intact limb so that its reflection shows up exactly where the phantom limb would be. Then they just move their intact limb, and boom, the brain gets tricked. It sees the phantom limb moving perfectly and pain-free, and that powerful illusion is often enough to start the process of rewiring that faulty map.
And that's just the tip of the iceberg. This core idea of tricking the brain with new sensory input is the engine behind all sorts of cutting-edge therapies now. Things like virtual reality, advanced prosthetics that tap into rerouted nerves, they are all at their heart different ways of helping the brain heal itself. Okay, so this is all fascinating from a medical standpoint, but why does it really matter to all of us? Why should we care so much about these phantoms? Because what they teach us is truly profound.
The very existence of phantom limbs pulls back the curtain on a fundamental and maybe even a little unsettling truth about every single one of us. That solid, real, physical world you're experiencing right now, it's not a live video feed. It's a simulation. It's a story your brain is constantly telling you about what's out there. And as phantom pain proves, sometimes that story can be very, very different from physical reality.
It really has been put perfectly. By studying this ghost in the machine, we aren't just learning about pain, we're getting these incredible fundamental insights into how our brains change, how they adapt, and ultimately into the very nature of human consciousness itself.
Which really just leaves us with one last big question to think about. If your brain has the power to construct the incredibly vivid, undeniable reality of a limb that does not exist, what else about the world you're seeing, hearing, and feeling right now is it just making up?